Today, you're going to learn how we can use technology to solve old world problems by addressing critical shortages of neurologists to a growing population. Quick, take a look at this hypothetical patient. Can you tell me which one is having a stroke and which one is having a Bell's palsy? They can look quite similar at first. But as you know, the difference between a stroke and a Bell's palsy could be the meaning of life or death in some cases. This is just one of an array of neurologic illnesses that patients present at a doctor's office, urgent care, or hospital. And it's imperative that there's a neurologist there to assess them quickly. But that's not always possible in our state and across the country. There's a shortage of physicians in the state, and there's areas what we refer to as doctor deserts. And this is most notable in rural areas, in rural communities. Now consider access to specialists like me, a neurologist, and these deserts become much larger, drier, and much more challenging. According to the American Association of Medical Colleges, there are 364 neurologists serving patients in North Carolina. That puts a neurologist to patient ratio at 1 to 27,876. Now add a layer of complexity with uninsured patients, and that ratio gets much worse. According to the North Carolina Association of Free and Charitable Clinics, a free neurology consultation is sometimes the hardest to obtain. In fact, the wait times at this clinic could be anywhere between 6 to 12 months. And it's not getting easier. The pipeline of neurologists is at tremendous risk, and that's because there's not enough residency slots. This is dictated by the federal government, which caps these slots. And we have an increase in the senior population. We refer to this as a silver tsunami, and it's a metaphor that refers to the huge increase in the senior population due to baby boomers aging and the population getting older. It is estimated that by 2050, 14% of the population will have dementia, such as Alzheimer's. Millions and millions of people at risk of neurologic decline. And how are we going to take care of these patients? Just like in North Carolina, communities across the United States are facing a shortage of neurologists, while at the same time a rapid rise in neurological illnesses. And we're using teleneurology, this should be a video, to help with access for these patients. And we've partnered with Specialists on Call Telemedicine. And it's the largest provider of teleneurology services to hospitals in the United States. But we're using them in a different way to help vulnerable patients in our state. The time is now for adopting teleneurology. 20% of patients 20% of Americans live in rural areas, and they can stand to benefit from telemedicine services as they live in areas that are far away from healthcare professionals. From the patient perspective, 64% of patients report that they would attend an appointment via telemedicine. And third, 70% of employers, as of 2017, reported that they would offer telemedicine services as an employee benefit. So clearly, there's a need. The North Carolina Association of Free and Charitable Clinics is who I partnered with for my project. And it's a network of 87 primary care clinics throughout the state with over 11,000 volunteer hours and over 80,000 patients served. And the way we use this technology is when a patient shows up to one of these clinics and the doctor that's working there needs a neurologist, they can use this platform to contact a neurologist in different ways depending on the needs of the patient. They can email, text, they can send images, or request a full neurology consultation via telemedicine. And this is something that is important for access to patients, because we know that if we intervene early, we can change the course of patients' illnesses. The idea is to make this easy, and we can do this via a smartphone that we all have. And the easier we make it, the more likely physicians will volunteer for this type of service. Currently, there's only 4 of us volunteering on this project, and clearly we need more. Let me give you an example of 2 patients I saw recently. A patient came to one of these clinics who had a seizure, and the physician there needed to know what to do next, but more specifically, driving restrictions. They were able to send a text with the information. I got a buzz on my phone. I was able to review it, and I was able to respond back that in North Carolina it was 6 months after a seizure before they can resume driving. And this was important for the patient to know. There was another patient that had an MRI of the brain completed, and the results came back as slightly abnormal. And the physician there didn't know, just quite sure what to do with that. So they were able to send the actual MRI images via this platform to me. I was able to review it and send a message back that this appeared to be a benign congenital lesion, that there was no need for further workup, and this avoided not only an unnecessary referral, but it also saved the patient months of anxiety while they waited for an answer. Some of the conditions that we can treat with teleneurology, conditions such as TIA, transient ischemic attacks, stroke, vertigo, balance disorders, seizures, movement disorders such as Parkinson's, and some neuromuscular evaluations. Now, some of these may require a doctor on site to help us with the exam while we give guidance via video. So, with the help of the North Carolina Medical Society, I surveyed physicians in the state about their experience with neurology consultation and telemedicine. And while this was for all patients, not just patients who had Medicaid or went to the free clinics, the turnout was not as high as we would like, but what we found was that even patients with insurance had to wait sometimes for neurologic consultations. And you can imagine this varies depending on your zip code. When asked if you had access to teleneurology consultations, how often would you use it? 40% responded that they would use it all or most of the time. However, that meant 60% reported that they would not. So don't be like this guy who gets frustrated with the computer. And again, this was supposed to be a video. So my project, we provided real-time answers for patients that showed up to these charitable clinics. We were able to do this with the help of volunteers who give up their time and expertise so we can reach a broader audience. But clearly, we need to scale this up. And as president-elect of the North Carolina Neurological Society, I advocate at the state and federal level for access to patients across the state. Currently, the North Carolina legislature is considering House Bill 555. Now, this has undergone some name changes, and the language of the bill is changing as it goes through various committees. But the guts of this bill is basically treating telemedicine visits as if they were face-to-face visits, meaning allowing physicians to bill for this service, which will allow greater adoption of this technology and wider reach, which is exactly what we need now. So the time is now. Let's remove barriers to access by using this technology that's ready, available. Contact your state, contact your representatives, and share with them that their constituents can get access to specialists like me, no matter where they live in North Carolina, if we implement these digital platforms into traditional medicine. We're at the cusp of using technology in innovative ways to truly change the course of our patients' lives. Let's embrace this new technology and turn a desert into an oasis where patients can thrive. Thank you.